Hey everyone, welcome back to the channel. Today we're talking about something that affects roughly half the world's population, and there's a good chance you're one of them. We're diving into vitamin D deficiency, why it's so widespread, and what you actually need to know about it. So let me start with a question. When was the last time you had your vitamin D levels checked? If you're like most people, probably never. Or maybe it came up once in a routine blood test, and you didn't think much about it. But here's the thing. Vitamin D deficiency is incredibly common, and it's not just about getting enough sunlight. Let me explain what vitamin D actually is, because calling it a vitamin is actually a bit misleading. Vitamin D is technically a hormone. Your body produces it when your skin is exposed to sunlight, specifically UVB rays. It then goes through a complex process in your liver and kidneys to become the active form that your body can use. This is why it's so unique compared to other vitamins that we mainly get from food. Now you might be thinking, okay, I go outside sometimes. I probably get enough sun. But it's really not that simple. There are so many factors that affect whether your body can produce adequate vitamin D from sunlight. Where you live matters enormously. If you live above the 37th parallel, which includes most of Europe, Canada, and the northern United States, the sun's rays during winter months aren't strong enough for your skin to make vitamin D, no matter how long you stay outside. The time of year matters too. Even in sunny locations, vitamin D production drops significantly in winter. And even when the sun is strong enough, you need significant skin exposure. We're not talking about having your hands and face exposed while wearing long sleeves. You'd need to expose your arms and legs for a meaningful amount of time, usually around 15 to 30 minutes several times a week, depending on your skin tone. And that brings me to skin tone, which is a huge factor that doesn't get discussed enough. Melanin, the pigment that gives skin its color, acts as a natural sunscreen. It protects against UV damage, which is great. But it also means that people with darker skin need significantly more sun exposure to produce the same amount of vitamin D as someone with lighter skin. Studies show that individuals with darker skin living in northern latitudes have some of the highest rates of vitamin D deficiency. Then there's age. As we get older, our skin becomes less efficient at producing vitamin D. A 70-year-old produces about 75% less vitamin D from the same sun exposure compared to a 20-year-old. This is one reason why older adults are at much higher risk for deficiency. Let's talk about what happens when you don't have enough vitamin D. Most people know it has something to do with bones, and that's absolutely true. Vitamin D is essential for calcium absorption. Without adequate vitamin D, your body can only absorb about 10 to 15% of the calcium from your diet. With sufficient vitamin D, that jumps to about 30 to 40%. This is why severe vitamin D deficiency in children causes rickets, a condition where bones become soft and deformed, and in adults it causes osteomalacia, which is basically the adult version of rickets with bone pain and muscle weakness. But the effects go way beyond bones. Vitamin D receptors are found in almost every cell in your body, which tells us it's doing a lot more than just helping with calcium. Your immune system relies heavily on vitamin D. It helps regulate both your innate immune response, the immediate defense against pathogens, and your adaptive immune response, the more specific long-term immunity. Research has shown that people with adequate vitamin D levels tend to have fewer respiratory infections. There's also emerging research on vitamin D and mood. We see higher rates of depression in areas with less sunlight, and while that's partly about light exposure affecting circadian rhythms, vitamin D plays a role too. Studies have found associations between low vitamin D levels and increased rates of depression, though we're still learning about the exact mechanisms. Muscle function is another big one. Vitamin D deficiency can cause muscle weakness and pain. I've had patients come in complaining of generalized muscle aches, fatigue, and weakness, and when we check their vitamin D levels, they're very low. After supplementation, Many report feeling significantly better within a few weeks to months. Now let's talk about who's most at risk. We've already mentioned people with darker skin and older adults, but there are other high-risk groups. People who are obese or overweight are at higher risk because vitamin D is fat-soluble, meaning it gets sequestered in body fat and isn't as bioavailable. People with conditions that affect fat absorption, like Crohn's disease, celiac disease, or those who've had gastric bypass surgery, often can't absorb vitamin D properly from food or supplements. People who cover most of their skin for religious or cultural reasons are at risk if they're not getting vitamin D from other sources. And increasingly, anyone who spends most of their time indoors, which in our modern world is a lot of people. We work inside, we're on our computers and phones, we drive in cars. Our lifestyle has changed dramatically from what it was even 50 years ago. So how do you know if you're deficient? The gold standard is a blood test that measures 25-hydroxyvitamin D, also written as 25-OH vitamin D. This is the storage form of vitamin D in your body and gives us the best picture of your vitamin D status. Generally, levels below 20 nanograms per milliliter are considered deficient. 20 to 30 is considered insufficient, and above 30 is considered sufficient. Some experts argue that optimal levels should be even higher, between 40 and 60. The tricky part is that symptoms of deficiency can be vague. Fatigue, muscle aches, mood changes, getting sick frequently. These could be anything, which is why so many people don't realize they're deficient until they get tested. If you're in a high-risk group or experiencing these symptoms, it's worth asking your doctor to check your levels. Now, let's talk about fixing it. There are 3 main sources of vitamin D: sunlight, food, and supplements. We've already covered why sunlight alone often isn't enough for many people. Food sources are limited. Fatty fish like salmon, mackerel, and sardines are good sources. Egg yolks contain some. Many countries fortify milk, and some fortify orange juice and cereals. But honestly, it's really hard to get enough vitamin D from food alone. You'd need to eat salmon almost every day. This is where supplements come in, and this is probably the most practical solution for most people. Vitamin D supplements come in 2 forms: D2 and D3. D3, also called cholecalciferol, is more effective at raising blood levels and is generally the preferred form. It's the same form your body makes from sunlight. The recommended dietary allowance varies by age. For most adults, it's 600 to 800 international units per day. But here's the thing. Many experts believe these recommendations are too low to achieve optimal blood levels, especially for people who aren't getting any sun exposure. Some physicians recommend 1,000 to 2,000 IU daily for general health, and higher doses for those who are deficient. If you're found to be deficient, your doctor might prescribe a higher dose to replenish your stores, often 50,000 IU once a week for several weeks, then dropping to a maintenance dose. It's important to retest after a few months to see if the dose is working. Can you take too much? Yes, but it's actually pretty hard to do because vitamin D is stored in fat, and it takes a lot to reach toxic levels. We're talking about consistently taking tens of thousands of IU daily for months. Toxicity causes calcium levels to get too high, which can lead to nausea, vomiting, weakness, and kidney problems. But this is rare and almost always from excessive supplementation, not from sun exposure or food. Your body has mechanisms to prevent making too much from the sun. One important note: vitamin D works best when you have adequate magnesium in your system. Magnesium is needed to convert vitamin D into its active form, and vitamin D supplementation can actually deplete magnesium. Some people benefit from taking magnesium along with vitamin D, especially if they're taking higher doses. So what's the bottom line here? Vitamin D deficiency is incredibly common because our modern lifestyle and various biological factors make it hard to maintain optimal levels through sun exposure alone. It affects far more than just your bones, influencing your immune system, muscles, and even mood. If you're in a high-risk group or experiencing symptoms like fatigue, muscle aches, or frequent illness, get your levels checked. Most people benefit from supplementation, especially during winter months. It's one of the few supplements that has strong evidence behind it, and where widespread deficiency is well documented. Before we wrap up, I want to emphasize that while I'm giving you this information, everyone's situation is different. The dose that's right for you depends on your current levels, your individual risk factors, and other health conditions. Always talk to your healthcare provider before starting any new supplement regimen, especially if you're taking medications or have health conditions that affect calcium metabolism. Thanks for watching. If you found this helpful, hit that like button and subscribe for more evidence-based health content. Drop a comment below if you've had experience with vitamin D deficiency. I'd love to hear your stories. See you in the next video.